smaller, limited open exposure. And over time, the techniques for all arthroscopic repairs are improving as well.
All right, we are here with Dr. Paul Sauer from Resin Orthopedics. We're going to go ahead and take a quick commercial break, and we will be back.
See you in a minute.
Are you a senior citizen that needs some extra help to get you through your day? Does your mom or dad need someone to take care of them while you are away at work? Or maybe grandma or grandpa need someone to run errands for them since they have a hard time getting around? Well, if you answered yes to any of these questions, then I want you to call Home Helpers at 815-836-2635. Home Helpers specializes in senior care. They'll assist with hygiene, help with bathing, assist with dressing, help with feeding, and aid with grooming. Home Helpers also will take care of light housekeeping, laundry, they'll make beds, they'll even run errands and pick up prescriptions. Daily telephone checkups and medication reminders are no problem for Home Helpers. Peace of mind and quality of life is what Home Helpers provides. Call today, 815-836-2635. That's Home Helpers, licensed, bonded, and insured. Trust the best in senior in-home care. Trust Home Helpers at 815-836-2635.
Yeah. Hey, Ross. I'm tired, man.
You tired?
I am tired.
That was 815-836-2635 for Home Helpers.
All right. Yeah, Doc, I do have a question. You know, when I was much younger, I had knee surgery. I had knee surgery 3 times where they actually had to take, the knee apart. They don't really have to do that anymore. And I was in the hospital actually for 3 or 4 days afterwards.
Yeah,
those days have changed,
things
right?
have progressed substantially. With the olden days when you had to make a big incision.
Do we need to call it olden days?
Yes.
We do? Okay.
Yeah, like back in the 70s, and into that's when scopes started coming out. We started being able to do more things arthroscopic, more minimally invasive.
Yeah.
And then the last decade for total joints, minimally invasive was a big push. So there was a push to do the operation for hip and knee replacements through much smaller incisions. And we've kind of relaxed on that. That's kind of fading a little bit as a fad, but we still make smaller incisions and the recovery is quicker. So it did help us kind of evolve over time.
So what do you see in the future as far as knee replacements and that kind of thing? Do you
Volume.
Being able to do more of it?
Well, just because of the baby boomers are reaching retirement age, and they are demanding a better quality lifestyle and being more active. So the projected numbers, like for example, we're doing about 300,000 hip replacements in the country per year now, about 550,000 knee replacements, but they're estimating by 2030 we could be doing about 1.2 million knee replacements.
Wow.
And I forget what the number is for hips, but it's probably 2 or 3 times as many hip replacements as we're doing now.
When you have someone that comes to see you, not everybody has to have surgery for, say, if their knees are bothering them. They can get injections to help take the pain away.
Absolutely. It's a stepwise progression. You start with anti-inflammatory drugs, therapy, sometimes certain injections could be used, modalities. Yeah, injections like...
Yeah, I would take a pass on the injection.
There's 2 types of injections, like steroid injections or hyaluronic acid injections like Synvisc can be helpful for people with sort of mild to moderate arthritic changes. So we use that stepwise progression as we progress up to the need for ultimately a total joint replacement.
Do you see a lot of big changes in technology coming up over the years here?
Well, there was a huge transition in the first few decades after hip and knee replacements started coming around in both the bone ingrowth surfaces, the designs. They became more anatomic based on studies of the population, how the joints are shaped and so forth. So I think there's less dramatic changes in that regard, but we are still evolving and trying to improve things with computerized navigation and different designs of implants, etc.
Awesome. Well, we have Robert and we have Megan here too from Resin that we wanted to just bring up a couple of things that are coming up. I know you have something coming up at Morris Hospital.
We do. We're actually going to have...
This is Megan. I know she doesn't sound like Robert, but this is Megan.
I'm not Robert. No, I am Megan. I'm the marketing coordinator with Resin Orthopedics and Sports Medicine. Happy to be here today. We do have an event coming up at Morris Hospital. We'll have Dr. Resin and Dr. Keith Resin, one of our orthopedic surgeons, our founder and president of Resin Orthopedics and Sports Medicine. He's going to be speaking at Morris Hospital this upcoming Wednesday. That's going to be at 6 o'clock at Morris Hospital. We encourage people to come. He's going to be talking about the signature knee replacement, which is a new revolutionary knee replacement that he's doing. He's actually the #1 producer of the signature knee replacement in Illinois and Iowa. So we're very proud of that and very happy to have him over at Morris Hospital.
Yeah, awesome. What's up, Robert?
Well, I think it's important, if you've never heard of Resin Orthopedics, to know that we have 5 locations, and 3 of them pretty much in the Will County area, and we have 9 physicians to serve you. And our physicians certainly do everything they can to get you back on your feet as quickly as possible. But we also realized early on that in addition to that, we had to have rehabilitation accessible to our patients. And what we pride ourselves in is that if you walk in as a patient, you see one of our physicians, you can get diagnosed, and we have all the equipment right on site to do that. And then if there's a determination that you need therapy, you can walk right down the hall and go to physical therapy. Of course, where you go for all this care is your choice. We're always hoping that you choose us. We've been around for 20 years. We know what we're doing. We have 146 employees. All of our staff is highly trained and very professional. And the work that I see, because I work in the rehabilitation area, I see the results of the work that our physicians and therapists do. And it's amazing to see how people come in and how difficult their lives are, and how with the care of our physicians and our therapists, they can get back to their normal activities. And that really is what it's all about, getting people back to where they need to be so that they can have the life that they deserve.
Yeah, and you know, Russ and I were talking about this too, and one of the big reasons we wanted to get involved with you folks was that we don't want people to be afraid to go in for a knee replacement. You know, my mom had the knee replacement, and you know, there's some recovery involved in it, and it does take time. But I think she's much better, and you know, she can actually walk and have a life. So I don't want people to be afraid. And Doc, we do know a little bit about you, and we know you're the man, and you're a little nervous, and I don't think you want to say anything, but you're the guy to go see. We know that. So.
Well, Dr.
thank you.
Sauer,
Yeah,
I'm
We're
sorry.
bragging for you.
I'm a
Sauer is-
personable guy.
I'm a personal guy.
I spend time talking to my patients, and you know, I won't push surgery. So I discuss all the options with them.
Do you sign your work when you're done? Why the
Yes.
silence? Well, you know, on TV you'll see sometimes where the doctor will put his initials or something on.
No,
the
that's
work.
before surgery, Ed. They sign you before surgery so they operate on the right part.
Didn't you ever see that where some doctor will sign inside?
No, I did not, Ed. That's only in your mind.
Okay.
No, but we do always sign our site before surgery.
Exactly. Yeah, the first
Yeah,
thing
no,
that
that's-
happened to me, I'm like,
That
"Oh,"
cracks
he
me
goes,
up too, though.
He
That
says, I want to
cracks
make sure I operate on the right
yeah.
part. I'm like, what do you mean? He goes, well, that way there won't be a screw up. I'm
They
thinking,
won't let us take the patient to surgery without putting our initials on the patient's skin with permanent marker.
uh-huh.
Well, I had surgery done someplace for some problems I was having with my foot, and the lady came in and thought I was having surgery on my head. I almost fell over. The other lady comes in, no. Yeah. That was one of those out surgery. It was a discount place where I paid $250, right, Robert?
That's right. Step right up.
Yeah.
I do want to encourage everyone, too, if they could, to go to our Facebook page. We are on Facebook, so if you go to www.facebook.com, please like Resin Orthopedics and Sports Medicine. Find out all the latest news and information over at Facebook with Resin Orthopedics
I'm a fan.
and Sports Medicine. Excellent.
I'm a
We
fan.
appreciate that.
And again, I just want to make sure people knew who you were and not to be afraid of it. So, Dr. Paul Sauer, we appreciate you coming on the show. It was awesome.
Thanks for having me.
Will you come back or no after this?
Absolutely.
Oh, you will? Okay.
Oh, they'll be back. Come on, they're hooked.
I know. We just figured he was looking over there because I'm done.
You know,
I'm not coming
my
back.
man Aaron here is with me right now, and he's looking like super bored.
Yeah, I
Look
know.
at him. He looks like he's going to eat the monitor.
Yeah. Well, I'm heading over to Marion Village. I have to head over there in a little while. I want to do a little plug for our friend Margaret. They have those garden homes.
Those are nice houses.
Yeah, I know. Have you seen those? I like to move in, but I'm not the right age, I guess.
Faith would take us over the timber. We'd let us move right in.
Really?
We could be there for the happy hour.
The happy hour.
They
That's
got
all you
great
care
food
about.
there?
Let's be honest. That's all you care about is the happy hour.
It always goes back to and sushi.
And sushi. Yeah. And our friend Kathy Smith over at Ingalls Hospice.
Our buddy.
We've been doing a lot of hospice work lately.
We sure have.
Yeah, scary amount.
Well, it's not
So-
just a scary amount. It's just that we're really. I mean, how do you say?
Well,
it? But
people
we're
die.
good at
I
what
mean,
we
that's-
do. I
yeah,
mean,
I
we're
know.
good. I mean, we really like taking care of them, and it's not just the client that we take care of; it's the family.
Exactly. Well, I'm always amazed when we'll see in a death notice or obituary and someone we've helped with hospice that they name us. I almost fell off the chair the first time I saw that.
Well, it's because we do good work.
Well, this week I got a letter from somebody who we had to be out there on an emergency basis, and the dad died. Nice guy, and they sent us a nice letter and talked about how great our staff was. Which
You know,